be showing you avian blood draws. And we have various types and sizes of birds that we'll show throughout this section. And really the blood draw technique is identical on all of them. What differs is how the bird is held or restrained. I prefer to always hold the bird myself. Some doctors will have an assistant hold the bird while they draw the blood, but typically I will hold the bird regardless of the size. For the small and medium birds, I hold the head, the neck, the body all by myself. And typically what I'm going to do is, this is kind of the posture to hold the bird as long as they fit in my hand. And I'm using the side of my thumb and this side here by the pinky to kind of cup the wings so the shoulders are held against the body. They usually are wrapped in a towel. And then I'm actually going to change hands. So we're cupping the wing here and here. And then I'm actually going to use my thumb to hold off the jugular vein, and this finger to kind of extend the neck, hold the neck up and in position, and the feathers out of the way. We will put some alcohol over the neck, mainly just to get the feathers out of the way. It's important to realize there are species differences in birds and what jugular vein is accessible. The general rule is for most birds, the right jugular vein is the only one that is patent or open, and so that's what you're going to utilize in most cases, but not all of them. So know your species, that's a big deal. So the larger birds, so the macaws, the cockatoos, some of the Amazons, my hands are often a little too small to hold them and to hold their body. So my hands often are too small to hold both their body stable and their head stable. So I will wrap them in a towel. I kind of put them under my arm and cuddle them under my arm. I will hold the head in the exact same fashion. So hold off with your thumb, elevate to get the jugular vein, but in the bigger birds, I will have a nurse kind of hold underneath their head just to hold the head stable. And that's just because they're stronger than I am. So that's a very useful tool. For all the birds during a blood draw, they're always done awake, no sedation. And we will routinely have a nurse scratch their head and talk to them and try to make it as atraumatic as possible. And generally they tolerate it very well. Typically you just need to hold off for a few seconds. However, I caution you, in birds that are suspected to have fatty liver disease or hepatic lipidosis, they often have clotting abnormalities. So they're more likely to bruise, to bleed, to get a hematoma. So in those suspect birds, you're going to hold off longer, you're going to check it thoroughly, you're going to make sure that it's clotted well. Typically, I tend to think of budgies as being a high culprit species for fatty liver, and also many of the Amazons, but it can be any bird. So tips to take away. Know your species, know what side the jugular vein is on, get used to holding and restraining birds and being very comfortable with them. Use a towel to protect their body, and it helps hold the wings in. And use a handler or a technician to scratch their head, talk to them, try to reduce stress, and make sure you know if they're a high-risk species for fatty liver based on their diet. It may be as simple as they've been on nothing but a seed diet, and if so, you're going to hold off a little bit longer. So the rule of thumb on avian blood draws, and I'll give this to you by example, is if we have an average cockatiel size, that's going to be 98 grams. A 98 gram cockatiel, you can technically take a maximum amount of blood of 0.98 cc's. But I caution you, I never do this, particularly on a sick bird, but even on a healthy one, I never take the max. So on a cockatiel and any bird, I'll take the minimum amount of blood required to run the test. Always the minimum, never the maximum. And so on a little cockatiel, we may draw 0.15 to 0.2 cc's max, and we'll run a whole profile out of that. On the little birds, I'll use a 27 gauge needle and a 1 cc syringe. As the birds get bigger, so cockatoos, macaws, 25 gauge needle and a 3 cc syringe. So just know your weight of your bird, know what you can safely draw. Now, you may ask, if you're in the vet field, how can you run a full profile off of this? This becomes very important for exotic species. You do need to use an exotic specific lab. So they will be able to run with a tiny sample much more diagnostic tests than you can do with some of the larger commercial dog and cat labs. And also, because birds have nucleated red blood cells, their blood cannot be run by the typical dog and cat machines in-house. So those are off because the blood cells are read inappropriately because all the cells are nucleated. So for birds, I'm often using the exotic specific labs rather than the bigger commercial labs. There is a time delay in doing that because we have to send those samples to a lab. So what if we need something immediate? that's when a manual blood smear and count becomes very important. So you can easily run a hematocrit, do a slide in-house, and do a differential off of it. You can see if the blood cells are toxic, and you can go from there. So a very useful tool with a tiny amount of blood giving you information on a bird. And by the way, I'm Dr. Pat with Little Critters. I've been a practicing veterinarian for 25 years. And on this channel, we focus on all things exotic pet related, their care, husbandry, and medical needs. If you like that, please give us a like and consider subscribing and sharing. We appreciate your watching. Thank you.